Okay, we are going to do a wound assessment, and we're going to use this wound right here. This is Pat pressure ulcer, and you're going to get to know Pat better as the class goes on. So I'm going to say that this is a sacral ulcer. I'm going to say that this is the head to toe direction, and this is the side to side direction. So after we've noted the location of the wound, we need to measure it. So the head to toe measurement is about 7.4, and the side to side measurement is about 6.3. And we need to measure the depth. Now, if the depth of the wound is the deepest part is in the middle of the wound, you need to put something across there so that you get the level of the skin. So the depth of this wound is 1.5 centimeters. Then we need to look for undermining, and in this wound there is undermining here, and you can see that from about 1 o'clock to 3 o'clock there's undermining of about 1.5 centimeters. Okay? And then you need to look for tunneling. And you should never assume that there aren't any tunnels. You have to look for them. In fact, in a wound like this, you should probably assume there is tunneling somewhere. So you poke around gently with the swab, and look at that. There is a tunnel. So let's say that at 5 o'clock, there is a tunnel, and that tunnel is 2.2 centimeters deep. Then you should note the eschar on this wound. That is from about 11 o'clock to 12 o'clock, and that is 2 centimeters by 1 centimeter. And here there is some slough. You need to note that, and there's some slough over here too. And if you look right here, you can see there's bone exposed. So at 6 o'clock there is exposed bone, and you need to note that. That's an important finding. And then you can look in this wound, and you can look at the dressings that you removed to assess the drainage. And here in the bottom of this wound is the pooling of some serosanguinous drainage. You need to, after cleaning the wound, which we've already cleaned this wound, you need to assess for odor. And I'm going to say that there's no odor in this wound, but there could be odor, because if this eschar is breaking down, that would cause some odor. But that's not a bad odor. We want the eschar to break down, so that odor would be okay, but you still need to note that. And then you need to look at the peri-wound skin, the skin around here, and you can see that it is intact. There's no erythema, no induration, no warmth, and all of those would also be signs of infection if those were there. Another sign of infection could be a sudden increase in drainage or a sudden increase in pain. Those are both possible signs of infection. So I think now we can say that this is a stage 4 pressure ulcer. And you probably could have walked in the room, removed the dressing, and looked at that and said, that's a stage 4 pressure ulcer. But we still need to do our assessment first before we make that determination. Since it's a pressure ulcer, obviously it's caused by pressure. In the sacrum, though, often that pressure is made even worse by shearing force when people have the head of the bed up and they're just staying in one position with the head of the bed up. That causes a lot of pressure in the sacral area. So to prevent wounds like this, it's important to try as best you can to have the head of the bed below 30 degrees for just for the prevention reasons. Of course, you probably need the head of the bed up farther when someone is eating, and and there are some medically necessary reasons, respiratory in particular, why somebody would need the head of the bed up higher. So then you need to check the skin often and try to turn them and keep them off of that area. Okay, that is a wound assessment.